आज जो हम लोग शुरू करने वाले हैं वो है एशरमैन सिंड्रोम। डीएनसी के बाद अगर पीरियड्स अचानक बंद हो जाए तो क्या रीजन हो सकते हैं, राइट? तो आज बात करेंगे उसी चीज की जिसको हम बोलते हैं एशरमैन सिंड्रोम। ये एंट्रेंस एग्जाम में बार बार पूछा जाता है। तो इन विद इन लाइक 3 to 4 मिनट्स हम एशरमैन सिंड्रोम को समझते हैं कि वो है क्या। ठीक है। सो देखिए, ये अगर आप डायग्राम देख रहे हैं, सो दिस इज अ नॉर्मल यूटेरस एंड दिस इज योर स्कार और द फाइब्रस यूटेरस है। So in Asherman syndrome, what happened? There is a formation of the scar और the fibrosis है, ठीक है। एक स्कार यहाँ डेवलप हो जाता है एशरमैन सिंड्रोम में। सो स्कार डेवलप होता क्यों है? ओके, द मोस्ट कॉमन कॉज जो मैंने बताया, आफ्टर द डायलिटेशन एंड द कुरेटेज। ओके, सो मोस्ट कॉमन कॉज अगर पूछा जाए इन योर एमसीक्यू, इन योर लाइक इन एंट्रेंस एग्जामिनेशन, your answer will be your dilatation and the curettage after pregnancy related events. For example, missed abortion हुआ, or there is an incomplete abortion, or the postpartum hemorrhage, retained product of the placenta, okay, of the conception. These are the most common causes. Or if there is some infection, for example, genital tuberculosis or severe endometritis, though it is rare, but yeah, these are the some causes. Or even if you do surgery, so even cesarean section or the myomectomy, these also resulting in the damage or resulting in the Asherman syndrome. Some of the radiation therapy is on repeated hysteroscopy or IUCD trauma. Okay, so sometimes this Asherman syndrome, the most common cause of the amenorrhea in Asherman syndrome is your dilatation and the curettage. Okay, even IUCD is there, but it is rare cause. So that is why Asherman syndrome, its another name is amenorrhea traumatica. Okay, its another name is amenorrhea traumatica. Okay, so I'm writing it here, amenorrhea traumatica. Okay, now suppose this is your normal uterus. Okay, and these are the layers of the uterus. Functional layer, these are the deep basal layer. Okay, so we know that in normal pregnancies, or in the normal during menses, ovary produces estrogen and the progesterone. What the ovary produces, they produces estrogen and the progesterone, and they help in the build up the endometrium and in anticipation of a pregnancy. So suppose if the pregnancy can happen, they may help to develop the embryo, hold the developing fetus. So for this reason, the ovary produces the estrogen and progesterone in the anticipation of the pregnancy. Now this endometrium, this has a two layer. One is functional layer and other is your deep basal layer. Okay. This is one of the question they can ask during the like menstruation. Okay, during the menstruation, which layer shed off? Okay, it is the superficial functional layer which shed off during the menses. Okay, so during the menses, this superficial functional layer shed off. Okay, so this is very important MCQs, one of the entrance question of the entrance examination. Now, this deep basal layer, this is responsible for the endometrium regeneration with the help of the hormones. Now, in Asherman syndrome, what happened due to the this type of the procedure? There is a damage of the deep basal layer. Okay, so what happened in the Asherman syndrome? There is a damage of the deep basal layer. Okay, so suppose if there is a damage of the deep basal layer. Okay, so this layer is damaged. So now we know that the deep basal layer help in the regeneration of the endometrium. So if they cannot help in, so what happened? There is a formation of some scar tissues or the fibrous. Okay, fibrosis develop or endometrium lining. It is replaced by the scar tissue. Okay, which is called intra-uterine adhesion. Intra-uterine adhesion. So that is why it's another name is a trauma, amenorrhea traumatica. Okay. Now, what are the clinical features? This is a very triad. Number one is your scanty period, hypomenorrhea, which is later resulting into the amenorrhea. Second is infertility, and the third is recurrent pregnancy loss. So the patient will come to you with either of these three symptoms. They either come to you that after my miscarriage, when I did the dilatation and the curettage, after the DNC, I have seen that my period has reduces. Okay, or after this operation, after the repeated, whatever the cause, you need to find it out in the past history. Okay, and in this case, the most common will be the dilatation and the curettage. Okay, the scanty period, that is amenorrhea, later resulting into the amenorrhea, infertility, and the recurrent pregnancy loss. So what happened here? Here the hypothalamic pituitary axis. Okay, so let me erase this. Yeah. So here hypothalamic pituitary axis is normal. Okay, the hypothalamic pituitary excess is normal. Okay, so even the follicular stimulating hormone is normal, estrogen hormone is normal, estradiol is also normal. Okay, everything is normal, but still the person is complaining of the amenorrhea or the. Okay, then what are the, how will you go with the diagnosis? Okay, there are two types. One is have to go with the ultrasonography. In the ultrasonography, you will see some irregular like a filling defect. The HCG will show that. Sorry, this is the ultra hysterosalpingography. This HCG will show you some multiple filling defect, and the ultrasonography, the endometrium will become thin and irregular. Okay, the thin, irregular endometrium. Okay, in ultrasonography, thin, irregular endometrium, and the hysterosalpingography, it will show your multiple filling defect. Filling defect is shown in the hysterosalpingography. Now, for the definitive diagnosis, they can ask in the MCQ, what is the definitive diagnosis? Then you have to go with the hysteroscopy. This hysteroscopy will help you to visualize if any adhesion is present in the uterus or not, but it's also helping the also to exclude any tuberculosis, genital tuberculosis. Sometimes with the help of the hysteroscope, we do the adhesolysis. Okay, we can take out the adhesions. So this is known as your hysteroscope adhe. Okay, adhesiolysis. But sometimes what happen, even after the adhesolysis, scar tissue can develop. Okay. So to minimize the development of these scar tissues, this type of the intra-uterine balloon catheter is used. So it is placed in between the endometrium lining. Okay, just to prevent the adhesions, and also some medications was given. So this is the whole procedure, the treatment procedure, and what is the Asherman syndrome. Okay, now just tell me the answer of this. A 28-year-old woman who is present with the secondary amenorrhea, okay, following by the DNC operation for the retained product of conceptions. Remember, retained product of conception, and after that she went for the she did the DNC operation, और उसके बाद उसको secondary amenorrhea develop हो गया. She also complains of infertility. So what is the most common cause? The answer will be Asherman syndrome. I hope you understand. In the next part, we will do the Sheehan syndrome. Okay, if you have any questions, you can just type me in the chat box. You need this topic. Okay, and if you have any confusion, any question regarding this, just type me in the chat box. Okay, and for the daily Gynae MCQ, do subscribe my channel. Okay.